But more and more studies that are coming out are revealing that Grochovetsky's probably right in the traditional way of thinking, which is that the legs propel motion is probably not correct. He believes that there's a spinal engine above that propels the legs, and rather than the legs propelling the body. So we're going to expound on that all the way through these video series. You don't have to know all of the driving mechanisms behind the spinal engine to still get the same results. It's thinking of it from a different vantage point and looking at the body in a different way that really makes it powerful. I usually like to get in on them with my thenar eminence and do the same thing, pushing the spinous processes that way, because that's the way they need to rotate anyway, right? So I'd be pushing the spinous processes, and I can kind of push through it like that, but it's not as effective as someone who can actually get your fingers on the body's the spinous process. The engine has to have lumbar lordosis to drive, but it can't have too much lumbar lordosis. So that goes back to Vladimir Yanda's upper and lower cross syndrome thing. Treat the facet joints. Basically, we treat them. We're going to use the bones as levers to move the muscles that are inaccessible any other way. What we're trying to do is to release the myofascial component of it, which are the fibrotic ligaments, the fibrotic joint capsules, and the transversospinalis muscles, particularly rotatories, the short rotatory, which is the most damaging because it's got such a short lever that it can pull on the locked facet joint above. It pulls from below and can lock the facet joint closed on the ipsilateral side, as you can see in the video here.